Hi everyone, welcome back to Sage Health TV. I'm Dr. Julianne Morella, and in this episode I'm going to be talking about the thyroid and the underlying factors that affect the thyroid. So first, let's remind everyone about the function of the thyroid. So the thyroid helps regulate metabolic function throughout the entire body. And so it helps regulate your heart rate, your digestion and your metabolism, your energy and mood throughout the day, your joint, your muscle health, your skin, nail, and hair health. And so it does this by releasing thyroid hormones throughout your entire body. When those thyroid hormones are low, we call this hypothyroidism. And the symptoms that are related to hypothyroidism is fatigue, depression, constipation, lateral thinning of our eyebrows, joint swelling, weight gain, and cold intolerance. And when these thyroid hormones are high, we call this hyperthyroidism. And the symptoms related to this are anxiety, heart palpitations, diarrhea, weight loss, and heat intolerance. So when treating the thyroid, I'm not just looking at the thyroid itself. It's important to also look at what else is going on in the body. So organs that I look at are the gut. So if there's any inflammation going on in the gut, the inflammation can actually prevent absorption of the certain nutrients that your thyroid needs in order to function properly. And those nutrients are B vitamins, selenium, zinc, iodine, and iron. And so it's important to treat the gut and address if there's any infections like SIBO, or if there's any leaky gut that might be caused by food intolerances. So I might suggest a patient to do a food allergy test or to try an elimination diet or avoid gluten and dairy. The other relationship that I'm looking at is the OAT axis. And so this is the ovarian, adrenal, and thyroid axis. And so in naturopathic medical school, we learn this as the three-legged stool. And so each leg, one is the ovaries, the second leg is the adrenals, and the third is the thyroid. If you can imagine that one of those legs is short, that stool is now off balance. And so whoever's sitting on that stool is going to be really uncomfortable. So when treating the thyroid, it's also important to also address any menstrual disorders, any hormone imbalance, any stress that might be causing adrenal dysfunction. And so there are external factors that can also bog down our thyroid, and one of them is metals and environmental toxins. So metals such as mercury, cadmium, and PCBs can bog down our thyroid and decrease our thyroid hormone. And so it's important to address any exposure to metals, whether it be from mercury amalgams in the mouth. So it's important to go see a biological dentist or dentist to have those safely removed, or address environmental toxin exposure through beauty products like makeup, lotions, and also cookware, and any exposures that you might actually have at work or at home. Another external factor that I look at are infections. So EBV, which is commonly known to cause primary mononucleosis, which is mono, or the kissing disease as we like to say. Mono or EBV has been associated with aggravating an autoimmune thyroid disease called Hashimoto's. So it's important to treat these infections to also make sure that the fatigue that you might be experiencing isn't just from your thyroid, but also it could be an infection, or it could be one or the other, or both at the same time. And lastly, the thing that I look at, which is the most basic thing to look at, is your diet. I want to make sure that my patient is following a whole foods diet that is rich in all of the nutrients that we discussed earlier, and make sure that it's void of any processed foods, greasy, fatty foods, or processed sugars, because this again creates inflammation in the gut that might be causing systemic inflammation everywhere. So let's wrap up everything I just said. So underlying factors that affect the thyroid. So the gut, we want to make sure that the gut is healthy, and we want to promote a healthy microbiome. We also want to check the OAT axis, so ovaries and adrenal health. We want to make sure there's no exposures to metals or any present infections. And we also want to make sure that we're eating a healthy diet that is rich in the nutrients that your thyroid needs, which are B vitamins, selenium, zinc, iodine, and iron. So I hope that you found this information all helpful. If you liked this episode, please check out our other episodes. Please like, subscribe, and share our channel. I'm Dr. Julianne Morella, and this is Sage Health TV. See you next time. Bye.